Hi, my name is Erin. I'm here with the pharmacy team to talk to you about a patient named Jacob. He's a 3-year-old male who presented to the emergency department with complaints of irritability, cough, runny nose, low-grade fever, and ear pain. He was started on Ceftonir 2 days ago for presumed acute otitis media, and since he started using that antibiotic, his fever has not resolved and he has had persistent diarrhea. Pharmacy was consulted for fluid management, for appropriate antibiotic recommendation, and for management of his pain and fever, as well as to discuss his current immunization status. Just a little information about him is he has a past medical history of 3 incidences of acute otitis media. The first was treated with amoxicillin at 27 months of age. The second was treated with amoxicillin as well at 29 months of age. However, this was discontinued due to experiencing a rash and was switched to Ceftonir. He also has a history of early onset neonatal sepsis, short bowel syndrome, and necrotizing enterocolitis secondary to the short bowel syndrome. At this point, he is G-tube dependent. He lives with his adopted parents. He was never breastfed, and his mother is noted to smoke 1 pack per day of cigarettes inside the house. He currently takes multivitamin gummies twice daily, and he is taking Ceftonir twice daily as well for the presumed acute otitis media. He has an allergy to eggs, in which he experiences a rash, and he also has an allergy to penicillin, in which he experiences a rash. His vaccinations are not currently up to date. So today, his vitals are blood pressure of 92/56, a heart rate of 130, a respiratory rate of 24, a temperature of 102, and he has experienced weight loss due to his diarrhea, in which his weight went from 15 kilograms to 14.7 kilograms in the last 2 days. He also is noted to have severe bulging of tympanic membrane in both ears. So based on his current presentation, we have identified that he has severe acute otitis media in both ears that is refractory to his current treatment with Ceftonir. He is also experiencing diarrhea secondary to Ceftonir, which has caused him to have mild dehydration, in which his estimated water loss is 2%. Although he only has mild dehydration, he is a candidate for parenteral fluid rehydration because of the fact that he is tachycardic right now. The goal at this point is to resolve the infection, to provide fluid rehydration, to reduce the heart rate to normal, and to manage the pain and fever, prevent future infection, prevent drug adverse effects, and to reduce any of his modifiable risk factors. To correct his current dehydration, we are recommending a fluid bolus of 300 milliliters normal saline over 1 hour, followed by maintenance fluid with D50 and 1/2 normal saline, 50 milliliters per hour for at least 24 hours and until the diarrhea resolves. In order to treat the infection, we are recommending ceftriaxone, 735 milligrams, IV, once daily for a total of 3 days. In order to manage the pain and fever, we are recommending acetaminophen suspension, 32 milligrams per milliliter strength, with a dosage of 5 milliliters every 4 hours as needed for pain and fever. At this point, like I said, his vaccinations are not up to date, so we're recommending the PCV13 for 1 dose, the flu block because it does cannot contain egg product for 1 dose, MMR for 1 dose, and follow up with pediatrician for second. The varicella for 1 dose and follow up for the 2nd dose, and the hepatitis A for 1 dose and follow up with the pediatrician for the 2nd dose with this one as well. In regards to his risk factors, we spoke with his father about the fact that his wife smoking inside is a serious risk factor for recurrent acute otitis media, as cigarette exposure can cause this infection to occur. We also spoke with him about the fact that his continued use of a pacifier is also a risk factor for recurrent acute otitis media. So for this patient, we want to monitor his weight daily to ensure that his fluid status returns to normal. We want to monitor his electrolytes to ensure that he doesn't need potassium replacement, because with his maintenance fluid, sometimes it is indicated to have potassium after the first urination. We also want to monitor for signs and symptoms of reduced infection, including reduced fever, reduced ear pain, and reduced cough and runny nose. We also want to monitor his heart rate to continuously until it returns to normal. And we want to monitor the IV site for reaction and allergic reactions from any of his medications. What are your thoughts on this recommendation?